Welcome to our mnemonic video on weakness differential. Let's get started. This story will take place at a theater. In front of the stage, we see an usher who's in charge of handing out the program booklets to the audience as they arrive. He is dressed up in his uniform and has everything ready. However, notice that he can't find the strength to lift his stack of booklets and looks very frustrated at his weakness. Well, this weak usher is here to remind us that this story is all about weakness differential. We will be discussing the focal and the general causes of weakness, and we're going to start with the focal causes. To help us with that, our first actor took his initial steps onto the stage. It looks like his act is not so good. Someone has thrown a red tomato and hit him right in the head, ruining his baseball cap. Well, let this head remind you of an accident, particularly a cerebrovascular accident or a stroke. This is a sudden interruption to the brain's blood supply, which can cause focal weakness. Now, a stroke can be either ischemic, secondary to a thromboembolic disease, or it can be hemorrhagic, depicted by this tomato oozing down blood-looking juice onto the head of that actor. It's crucial to discriminate between the two types because this will change the management quite a bit. In emergency settings, a non-contrast CT scan is very valuable to help you make that distinction. Well, another actor just appeared on the stage. He seems to be doing a little better than our first tomato-covered actor. He is costumed as Droopy, the cartoon dog whose face appears weak and droopy. And if you noticed, his eyelids are half closed, which should make you think of ptosis. And note that Droopy is dressed in this military costume, but he is still powerless to hold up his rifle. Well, that weakness, and the facial drooping and ptosis, should remind you of myasthenia gravis, another disease that should be on the differential diagnosis of focal weakness. As a brief review, myasthenia gravis is an autoimmune condition that results from autoantibodies that attack the nicotinic acetylcholine receptors at the motor end plate. Treatment involves acetylcholinesterase inhibitors such as neostigmine or pyridostigmine, immunosuppressants like prednisone, and, in some cases, removal of the thymus gland. And let's take a closer look at Droopy's military costume. This green beret on his head tells us that Droopy is not just any soldier. He's a Green Beret, another name for the U.S. Special Armed Forces. Well, Green Beret sounds like Guillain-Barré, a demyelinating autoimmune disorder that targets the myelin sheath of the peripheral nervous system, causing rapid ascending focal weakness. Now, the autoimmune process is often preceded by an infection, such as a Campylobacter jejuni infection. Treatment is usually supportive, but intubation may be necessary if that muscle weakness ascends up to the level of the diaphragm or the respiratory muscles. Now, off to the left of the stage, we can see palm tree props bundled away from last night's show. Notice that some of the palm trees are wrapped to be protected while others are not covered. These palm trees should remind you of nerve bundles, and the wrapping should remind you of myelin sheaths around them. And the fact that some of the trees are unwrapped or demyelinated should make you think of demyelinating autoimmune diseases, particularly multiple sclerosis. And this can present with basically any neurological symptom, which includes focal weakness. Now, the course of the disease can have various patterns. However, the relapsing and remitting pattern, such as that sudden deterioration of the patient's condition followed by an improvement, is the most common pattern you'll see. So up here on the left of the stage, we've talked about Guillain-Barré, we've talked about myasthenia gravis, and multiple sclerosis. Now, a little more off the stage, we can see two actors preparing for their show. One of them is portraying a doctor, while the other is playing the patient. They must be planning to perform a medical scene, although it's anyone's guess how that will fit into this complex appearing plot. Well, let's look closely at the doctor. He's holding up a spinal MRI image in front of the patient's back. And you can tell that he's an actor and not a real doctor because he holds the MRI image horizontally instead of vertically, so that the spine in the MRI doesn't actually line up with the patient's actual spine. Notice that one of the stage spotlights is illuminating only a part of the spinal MRI image, so that the light is cutting across the spine, and the bright white streak of light extending across the spinal MRI and the horizontally or transversely tilted image should make you think of transverse myelitis, which is an inflammation of the spinal cord that spreads horizontally. Notice also that the actor playing the patient is on crutches, indicating that she is weak, which should remind you that transverse myelitis can be another cause of weakness. And this condition can occur in the setting of post-infection, post-vaccination, or autoimmune conditions. And the signs and symptoms will vary according to the affected level of the spinal cord. Finally, the mainstay for treatment is plasmapheresis, but steroids can also be considered. Now that we've discussed focal causes of weakness, let's discuss more general or systemic causes of weakness. Not only the actor's preparation is bad, but also the arrangements behind the scene. In standard settings, this pool gets filled with water for a swimming scene. But as you can see, this pool is not ready for that. It's drained entirely, making this performance mess even worse. Well, this empty pool should make you think of hypovolemia, which can cause weakness. Hypovolemia can result from a myriad of conditions such as excessive sweating, a diarrhea illness, diabetes insipidus, diuretic use, and many more. But this is pretty intuitive. If you take so much fluid out of the body, whether it be through drugs or some other pathology, then they're not going to have enough fluid. So they're hypovolemic. And being hypovolemic will make you weak. And treatment will include treating the underlying cause of the hypovolemia, but also supportive measures like fluid resuscitation. So you would give something like IV normal saline. Now, it must be very frustrating for the production director. And we can see him sitting on the steps of the pool looking stressed over his play. He has not been eating or drinking properly lately because of his stress. So he takes this moment to consume a Jugel. Jugel is an electrolyte drink powder, usually mixed with water to dilute it. This director is so stressed that he's chugging the mix directly without even diluting it. One can imagine that an electrolyte mix would have a high concentration of electrolytes, and that consuming it undiluted would cause an electrolyte imbalance, which can lead to weakness. Electrolytes should therefore always be monitored in patients experiencing weakness and be supplemented or held accordingly, depending on the specific derangement. Now, this director may have a poor sense of diet, but he does have a strong sense of style. Looking closely at the director, we notice he's wearing a small bow tie. A bow tie seated in the front of the neck like this should make you think of the thyroid gland, and the fact that it's small should make you think of a small thyroid gland or hypothyroidism. Hypothyroidism causes disturbance in metabolic activity, and that can present with weakness, weight gain, decreased cold tolerance, dry skin, and lack of energy. And treatment usually involves an administration of levothyroxine, in addition to proper management of the underlying cause of the hypothyroidism. It's time to look at the crowd and see how they're reacting to all of this. As you can tell, some people in the audience are not happy about how poorly things are going. In fact, we can see a duo throwing rotten tomatoes at the actors. Now you know who hit that actor in the head in the first place. And notice the man's t-shirt and shorts are red in the proximal areas of the upper and lower extremities. The location of the red pattern should make you think of the proximal extremity weakness seen in polymyalgia rheumatica, a rheumatologic condition characterized by muscle pain that classically involves the shoulders and hip girdles. Now, his accomplice, kneeling beside him, has a butterfly-shaped rash on her face, much like the malar rash associated with systemic lupus erythematosus, or SLE, or lupus. And lupus is a rheumatologic condition that often presents in young women and is diagnosed with a positive ANA and anti-double-stranded DNA antibodies on laboratory testing. To clean that mess, we see a Roomba robot, which is our recurring symbol for rheumatoid arthritis. Those are approaching those tomatoes to clean them up. Well, these ideas here should remind you that rheumatologic conditions should be on the differential diagnosis of your patient with weakness. While that duo was angry at the show, another duo was thinking differently. And this guy took advantage of the amateur show and decided to make a romantic proposal in front of the crowd. However, from the way this man looks, his date probably turned him down. He can't even find the strength to stand up and face the crowd after that rejection. Well, this depressed, rejected man should remind you that depression can cause weakness. Now, weakness is a psychomotor manifestation of depression. Recall the P in the classic dig spaces mnemonic, which is the diagnostic criteria for major depression. And to remember the diagnostic criteria for major depression, there's actually a few mnemonics. Some people use dig spaces, some people use SIG-E caps. In either case, there's a P, and that P stands for a psychomotor symptom. A psychomotor symptom like weakness. As a preparation for his proposal, this man brought some decorations with him, and it seems as if he had gone all out for his planned proposal. Just look at the red, heart-shaped balloons. Even they look deflated after this rejection. Well, red balloons should remind you of red blood cells, which carry oxygen throughout the body. And deflated balloons, such as we see here, cannot hold as much air. Just like a patient's red blood cells, in the setting of anemia, cannot collectively carry as much oxygen. Therefore, these red deflated balloons should make you think of anemia. Another cause of general weakness that can be detected with a CBC test. Once anemia is diagnosed, further testing is required to find the underlying cause. Balloons weren't the only thing this man had brought, however. Just look at the heart-shaped chocolate box. Not only did she break this man's heart, but she also broke his chocolate box. Well, this heart-shaped chocolate box should make you think of cardiac issues, which can cause weakness. Now, general cardiac issues include aortic stenosis, congestive heart failure, and really any other cardiac conditions. The decreased tissue's oxygen supply is a shared feature between anemia and cardiac problems. Nevertheless, the mechanism is different. Anemia decreases the oxygen carrying capacities of the red blood cells, while cardiac problems decrease the delivery of sufficient red blood cells to the tissues. In either case, the declined oxygen supply to the tissues will result in weakness. Now, right next to this poor guy, we see the front row seats dedicated to the VIP audience members. Looking closely at this man occupying the seat, it becomes apparent that VIP, in his case, must stand for very infected person. Just look at how gray, ill, tired, and weak he looks, as if he has some sort of infection. Well, this infectious-looking man should remind you that infection can be a cause of weakness, because it upregulates metabolism and the immune system, causing fatigue and weakness. And right next to his seat, we see his backpack, and as you can tell, he must have filled it with different meds. Now, it looks like this kid decided to mess with that man's medications. In fact, he's replacing the stolen medication with candy, hoping that the VIP won't notice as quickly. In other words, he's changing his medication. Medication changes are a common cause of weakness and should always be asked about when a patient presents with weakness. So they come in weak, you say, have you made any changes to your medications? So medication changes can cause weakness. But that's not all. This punk kid isn't only taking the pills, he's also taking a bottle of some unknown substance. Looking closely at the bottle, we notice a skull with crossbones, indicating that it's something dangerous. Whatever is in there cannot be fit for children. In fact, the skull and crossbones symbol should make you think of toxins, and toxins can cause weakness. In fact, when a given toxin gets dangerously high, that it results in a syndrome known as a toxidrome, then you've usually got a medical emergency on your hands. And handling that requires a lot of urgent management, including calling poison control. And with toxins and toxidromes, we wrap up our video on the differential diagnosis of weakness. See you at the next show.